Heart disease tends to be used by different people in many ways, and it can be confusing. The one thing we know for sure is that heart disease is a chronic disease that is usually age related, and it is something that we can prevent. Not until the 50s did we discover important scientific discoveries from diet and lifestyle and even medications to actually prevent, to the point of some heart experts saying that we can completely abolish heart disease. Now, I'm not quite sure that's true, but we can definitely prevent heart disease, especially in those who are at highest risk for developing heart disease. So, welcome to Dr. Ashori. I'm a family medicine physician turned health coach. And in these series, I really want to break down certain diseases and help you come up with some important actionable things that you can do to help decrease your risk of developing these chronic conditions. Heart disease is a term that we use for generally damage to the heart or conditions with the heart, specifically atherosclerotic cardiovascular disease, often termed ASCVD, or CVD cardiovascular disease. And this can come in different ways. There is the plaque deposit in the arteries that sit on top of the heart. These are the large arteries that we can put a catheter in and open them up with a stent or bypass them with another vein or artery. And then there is microvascular disease that happens in the really, really tiny vessels. And that's a little bit tougher to manage with a lot of the medical treatments that we have right now. Of course, heart disease can also refer to heart failure. High blood pressure is often referred in layman's terms as heart disease. Atrial fibrillation, which is an electronic misactivity of the heart, is also often falls under that umbrella of heart disease and a few other things. Heart disease generally, for the most part, is led by high blood pressure. The second thing is probably the elevation of certain cholesterol markers in the blood, LDL-C, ApoB, VLDL, triglyceride. And then other factors are probably metabolic stuff, or sometimes we call it cardio-metabolic stuff. And this would be elevated blood sugar, insulin metabolism, insulin balance. All of these can contribute to cardiovascular disease or heart disease. On top of that, it's important to note that a lot of people who are very sedentary, who are either incapable of or just are not, just don't prioritize exercise, are going to have very weak hearts. And weak hearts tend to actually get a little bit larger, more, fit hearts tend to be a little bit smaller. Of course, when you go to the extreme, you can develop other issues. And balance in life is always the most important thing that you can do. If I were to give somebody general advice when it comes to heart disease, I would say look at your family members. Now, if you are adopted and you don't know your family history, that's going to be a lot harder. But the first place I always like to look is somebody's family history. I look at my family history, I really don't have any heart disease. Now, my father did have a cardiovascular procedure done, but I don't actually believe it was due to heart disease per se. And that's a whole different discussion of how Western medicine manages and handles certain diagnoses in heart. I have patients under my care, I have coaching clients under my care who have extensive heart disease to the point of that their dad, their uncle, their brother, they have all had major cardiovascular events under the age of 50. For these individuals, there is likely a multifactorial milieu of things that are increasing their susceptibility to causing blockage of the arteries, decreasing oxygenation to the heart, or allowing the heart to perform at its best. For these individuals, it's really best to intervene as soon as possible. And yes, I totally understand that if you are one of those individuals, you may not want those interventions. You may not want traditional Western medical interventions. You may not want a statin drug, a PCSK9 inhibitor, or all the other new medications that are out there. In those cases, of course, it's important that you prioritize other things, including stress management, which will increase inflammation, metabolic health, so the way your body manages insulin, and your dietary factors that to make sure you get the right electrolytes, protein, healthy fats, especially healthy fats, and the right amount of carbs with fiber to help you improve your overall risk to not develop heart disease in the first place. And of course, as a lot of healthcare experts fortunately talk about these days, exercise, movement, some regular activity that increases the oxygenation to the heart. Many times, in my practice, in my family medicine practice, I have patients who had a heart attack, a major event in their life, but because they were active, because they had a lot of good oxygenation to the heart, their heart recovered very, very well. And so we know there are ways to decrease heart disease. So I hope I gave you guys a good idea. Again, my name is Dr. Ashori, family medicine physician. Subscribe below if you're interested to find out more, and thanks for tuning in.